Wow. You can see. Want to say something? Let
Carry your candle, run to the darkness, seek out the helpless, confused and torn, and hold your candle for all to see. Take your candle, go light the world. Take your candle and go light your world.
the National Nurse Association of Kenya and other professional organizations and the medical fraternity at large is mourning the demise of one of our colleague, Marian Awor Adumbo, who passed away yesterday, 2nd August 2020, from COVID-19 complications, leaving behind a baby boy who is slightly over a week old. Our comrade, who was a dedicated nurse working at Rachuonyo Sub-County Hospital, was admitted at Homabay County Hospital with flu-like symptoms in pregnancy, where she tested negative for COVID-19 about more than a week ago. She developed breathing complications and was transferred to Kisii Teaching and Referral Hospital, where another test was done and the result was positive for COVID-19. It's important to note that at Homabay County Hospital, she tested negative, but on admission to Kisii Referral, Teaching and Referral Hospital, she tested positive for COVID-19. During her stay at the Kisii Referral Training Hospital, Marian gave birth to a baby boy while still on critical care on 27th July 2020. But unfortunately, on 2nd August 2020, her condition worsened and sadly, she passed away at around 4 p.m. yesterday. We have lost another comrade who was left behind, a child who will never be able to meet his mother, and this is very unfortunate to the medical and health care fraternity. Sadly, in a span of 5 months, we have lost 3 nurses who dedicated their lives to fight the COVID-19 for the sake of our country. And in respect and honor of Clifford Manyara Buria, a 58-year-old nurse anesthetist who was working at the Kitengela Medical Center, Mr. Moses Gitonga Ringera, 49 years old clinical nurse working at the University of Nairobi Clinic. And what happened yesterday, we lost Marian Awor, only 32 years, at her prime age, was working at Rachuonyo County Hospital. May their souls rest in eternal peace. May the Almighty God grant their families the strength and courage to overcome these difficult times. We will live to remember them as comrades, true heroes and heroines who fought for the best of our country, for the best interest of our country. Following these unfortunate incidents, we reiterate our statement issued on 22nd July 2020 over concerns of rising cases of COVID-19 amongst the healthcare workers. We have realized that county governments are not prepared enough to handle COVID-19. Our demands are still not met, and what we need is action and less words for the benefit of our healthcare workers and our people. As National Nurses Association of Kenya, we demand that both the national and county governments should move with speed to ensure that healthcare workers have the following before we shall soon, one day, wake up and find no one to take care of our citizens, including you. At the pace we are going, we shall find no one, no healthcare worker, no healthcare professional at their places of work, not because they don't want to work, but because they are unable to work because they are sick. At the pace we are going, we strongly demand for the provision of adequate and quality protective equipments. These are songs we have sung since the COVID-19 broke out. It's unfortunate. It's very, very unfortunate, if not evil, that some procurement officers are still procuring substandard PPEs and are giving them the healthcare professionals. A case example is in Kisumu, where the masks that were procured by the county government, verified by the county government, but upon reaching the users, they were found to be substandard. Apart from provision of adequate and quality personal protective equipment, we must train our health workers. If you provide them with the PPEs and you don't train them, actually there's nothing that you've done. Because in the process of also donning and doffing of the PPE, there's a very high chances of infecting themselves and infecting their colleagues. Number 3, we need to enhance adequate psychosocial support to all healthcare workers. Healthcare workers are not immune to the pressures that the country is undergoing today. They are also part of the society. They have families. They have friends. They are part of the community. We need to give them the psychosocial support so that we can cater for their mental wellness. Number 4, we must employ more health workers in all 47 counties. I don't know what the governors and the national government are waiting for. The president offered the welfare package, which had some economic stimulus to beef up the efforts that already the Minister of Health and the county governments are giving. And one amongst them was to employ more health workers. This has not been done. That's why we are saying one day you will wake up and find no health worker to treat you or to take care of you. We need to pay our health workers their salaries and their allowances on time. Many counties, as you are speaking today, have not paid salaries in the tune of even 3 months. And we are seeing governors, this is just laughable. We are seeing governors proudly, without shame, saying that, oh, I have 19 beds, I have opened this facility, I have 9 beds ICU, I have 5 beds ICU, I have bought 10 ventilators. And they have not paid their workers. Where are their priorities? And they're showing us empty beds that only has blankets. Shame. So, total hypocrisy. Let us stop this PR and address the real issues. Lastly, we need to motivate the healthcare workers through enhanced risk allowance and a special insurance to support our deceased colleagues. I mean, the number of healthcare workers getting infected today, probably by the end of the week, we may reach, or the end of 2 weeks, we may reach 1,000 plus. It's so high. Now we are losing them. How can you lose health workers at that rate and you still pay them 3,800 as risk allowance? And they are the first and the last line of your defense in battling COVID-19.